Today we're going to talk about medication administration from Chapter 4. And the administration of medications onto the sterile field is a team effort. Most of the time our medications from the sterile field are delivered to the scrub by the circulator. And it is our responsibility to pass the medication to the surgeon during the procedure. We are given a heads up as to the surgeon's preference by their preference cards, as it will list exactly which medication he or she wants for the case. Remember, it's our job to repeat the medication back to the circulator, accepting the medications into our medicine cup, labeling them immediately, passing the meds to the surgeon in the syringe, and saying the drug and strength out loud when passing. There is some debate on whether there is 5 or 6 rights of medication administration, but for our sake we say 6. Please write these down and make sure you are aware of the 6 rights of medication. The first one, right drug. What drug is required? The second, right dose. How much of the drug is required and in what concentration? Right route. How will the drug be administered? Usually for us it will be injected subcuticular. An example would be lidocaine. Right patient. Who will be receiving the drug? Right time. When will the drug be administered? And right documentation. The circulator will ask you at the end of the case, what is the total amount of local that you used? And you will need to provide a final total of each medication you have from your sterile field. It is the scrub and the circulator's responsibility to minimize the potential for medication errors as far as identifying medications. So this is why we always repeat the medication out loud when showing the bottle from the circulator as far as labeling it immediately. Delivery to the sterile field. We must follow aseptic technique when delivering and receiving medications into the sterile field. The circulator can either draw up the medications in their own syringe and then empty the contents into your med cup, or they can have you draw up the contents from the vial into a syringe and simply pour the contents into your med cup on the field. When drawing up medications, we always use an 18 gauge hypo needle because it is a larger size. The lower the number, the larger it is, and the bigger size, the smaller the diameter the hypo is. Please reference the video Drawing Up Meds on the Sterile Field. Labeling medications on the sterile field. On your back table, you will have plain labels or stickers that you're able to fill out and label your medications. So all you really need to do is take your sterile pen on the blank label and write down the name, strength, and expiration date. Always remember to label your syringe as well, being careful not to cover up the numbers on the side of the syringe. Remembering to label your irrigation, and never be embarrassed to speak up if you're confused, and always admit to an outright error. Again, the surgical conscience comes into play as a healthcare professional. Honesty and integrity are vital. Handling medication. Sometimes a surgeon will want 2 medications. So an example would be lidocaine and marcaine. You would want to have 2 medication cups and keep both medication cups separate on the back table. They may want to use a 50-50 or a 1-to-1 mix, meaning if you have a 10 cc syringe, we would draw up 5 cc's of lidocaine and 5 cc's of marcaine. Or sometimes you will have radiopaque contrast on the field for when we do live x-rays. The surgeon will usually want this diluted. So again, if we have a 10 cc syringe, it would be 5 cc's of the contrast and 5 cc's of saline. The preference card is something that you will really want to look at before each case. Please watch the video on syringes, reading syringes, and all things sharp safety. As far as supplies go, we do have some needles that need to be mentioned as far as recapping. We never want to recap a needle due to the puncture injury that could occur. And it's also dangerous. We always want to protect ourselves. And so when a needle is not being used, it always must be recapped between injections. So to do that, we need to do the 1 scoop method. I will show you in lab and we will practice loading syringes and using the one-handed scoop method. Also, the surgeon may want more than 10 mLs of local, so we have to refill the syringe. We then have to carefully remove the outer sheath and refill the syringe. Remember to always gather all of your sharps and dispose of them in the sharps bin after the case. You put the hypo needles in the needle box.